in your lunch hour with us. My name is Chachi Angelo. I'm the Director of External Affairs for Penny, and I'm joined by our Outreach Manager, Allison McKee. Appreciate you taking your time to hang with us as we talk about some new market opportunities in Pennsylvania, specifically through Penny. A couple housekeeping items. Our broker recruitment and diversification team is standing by. So if you have any questions, you can drop them into the chat. I do want to caveat that though. If you're having issues around certification or specific customer issues with application, please use the phone number, call our customer service, or email brokers@penny.com. We don't want to try to work through those in the chat during this presentation. Allison, if you don't mind putting up a quick poll to poll our audience to see your familiarity with Penny and if you've sold on Penny before. And this actual presentation is available right now at agency.penny.com/brokers. At the end of the presentation, I'll show you a little screenshot of where it is, but it's right under the Get Help section. So appreciate your input, just trying to understand who we're talking to. Folks that may have a health line of authority in Pennsylvania and are looking to sell on Penny and learn about the opportunities there, or those that are familiar with Penny, sold on Penny, just trying to get an idea of who we're talking to. So again, appreciate you spending your lunch hour with us. This should only be about 15 or 20 minutes. And I'll kick it over to Allison McKee, our Penny Outreach Manager, to run through the first couple slides, and then I'll take it home. So go ahead there, Allison.
Hi, everyone. Thank you so much for joining us. I'm going to go ahead and leave the poll open just for another maybe couple seconds to see if any more responses come through, and then I'll close it out. Again, we're just trying to get a sense of who's here with us today. Okay, I'll go ahead and close that out for everyone. So thanks so much for joining us. As Chachi said, I'm the outreach manager here at Penny, and what we thought we would start out with, just to give everybody some foundational information, is a really quick overview of Penny. I'm not going to spend a ton of time on this, but we want to make sure everybody kind of starts off with the same information. So Penny is the official health insurance marketplace for Pennsylvania. We're the home for individual, high quality, affordable health and dental plans. We're the only source for financial savings in the form of tax credits. So many of you have heard of APTCs. It's a way to reduce monthly premiums and help consumers save money on their health insurance costs. We're the place that customers can go if they don't receive coverage through their job, if they're self-employed, if they're not eligible for things like Medicaid or Medicare, uninsured in general. Important dates that we want folks to keep in mind coming up very soon. Open enrollment starts November 1st, goes through January 15th. But the thing we always like to remind folks is that anyone who experiences a qualifying life event, so it can be a long list of things like losing coverage that they already had, getting married, birth or adoption of a child, moving, many, many more. But those qualifying life events open what we call a special enrollment period, and then customers are also eligible to enroll. So those are, open people to enroll many times throughout the year. So while that open enrollment is concentrated from November 1st to January 15th, we're helping people enroll through those qualifying life events throughout the year. We also like to let folks know about Path to Penny, which is a way that Pennsylvanians can enroll in a streamlined way when they're filing their taxes each year. So at the bottom, we just have a quick snapshot of where we were in terms of enrollment in January as of this year. We were just talking the other day, and I believe that number is even higher now. So we're excited to head into open enrollment and see if we can get even more Pennsylvanians covered. And also interesting to know that 90% of our customers are eligible for financial assistance. So again, we're a great place for folks who are looking for financial support and assistance to make that coverage more affordable. So we also talk about all the time, especially on the outreach side, high quality health insurance. And what we mean by that is Penny plans all cover these 10 essential health benefits. They're all listed here. I'm not going to go through all of them, but we know that these are many things that customers are looking for, making sure that emergency services are covered, maternity and newborn care, things like prescription drugs, and of course, preventative and wellness services. We want customers to know that they can't be denied coverage for pre-existing conditions and that health plans can't limit what they're spending on their care, whether it's over a year or over the lifetime. We also just want customers to know that when they're shopping through Penny, they can feel confident that they're getting high quality coverage. So moving into a little bit about the initiative that brings us here today. So this webinar is brought to you by the Broker Recruitment and Diversification Initiative, and all of us on the call are a part of that project. We wanted to share a little bit about the goals of the project. Obviously, we know that brokers are a great resource to bring people into Penny plans. So one of the simple, really clear goals is to get more brokers to sell plans on Penny. We know what an important resource you are to help Pennsylvanians getting covered. And then the other part of this is we know that Pennsylvania is a huge state with lots of diverse communities, and we know that it's important to have diverse brokers helping sell those insurance plans to diverse communities in Pennsylvania. So making sure that the broker community kind of matches the diversity of the Pennsylvania community. We can go ahead to the next. So giving a little bit of an overview of where the project has been and where it's going this year. So in 2023, the project really focused on 4 zip codes in Philadelphia, and you can see those listed out. And we're really excited to be able to share that as a result of that work, 50 new brokers were added, and that was as of the beginning of January. And we know that that resulted in about 430 new customers coming in to Penny and getting covered, which we're really excited about as well. And the way that that work happened was through a lot of engagements and partnerships. You can see some of those listed out here, working a lot with our state agency partners, professional associations, Penny insurers, of course, brokerages, and our outreach team and other Penny staff being at professional conferences, talking to folks and helping really be out there and spread the word. As we moved into 2024, I think one of the things that the Penny team really saw is that it was hard to get an understanding of what broker demographics looked like, and nobody was really collecting that data. So Penny decided to put together a broker demographic survey to collect information about what the demographics of brokers look like in Pennsylvania, disseminated that survey, and collected some of that data. And in a minute, Chachi is going to talk more about that survey and what we found. But then we also decided to expand this project from just the 4 zip codes in Philadelphia to all of Philadelphia County, so the full 86 zip codes in Philadelphia. And now I'm going to pass it on to Chachi.
Yeah, and I mean, last year gave us a really great pilot to understand where we are, and we're just kind of continuing that through into 2024 and into 2025 of building upon what we've learned through this initiative. And one of the things that we learned was, yeah, nobody is collecting broker demographic information. So we sent out an ad hoc email and it was asking those demographic questions of brokers. And what we found was, we got a small pool. 714 brokers responded, and just over 60% were Penny certified. We also sent them out to brokers that have a health line of authority that are in Pennsylvania. So we got a fair amount of folks that have no skin in the game, that actually replied to that survey. And this survey is actually going to be at the end of the broker certification that's happening right now. And we encourage you to take that survey just so that we can get a broader pool of what our brokers look like in Pennsylvania. And what they look like is really broken out here. So, a vast majority of our brokers are over the age of 45, are very experienced with at least 10 years of broker experience, predominantly white with smaller percentages as Black and Hispanic Latino. Most, if not all, speak English with a very small percentage speaking Spanish, majority male, educated, and majority are independent brokers, and a third reporting that 100% of their business is health insurance related. So this was the first snapshot that we got of the broker survey. So what does that mean in terms of market opportunities. And we really wanted to kind of show that with, one specific zip code to show, where the uninsured and where those that are penny eligible, meaning that they're eligible for a qualified health plan, QHP, and what that looks like compared to the demographics of our broker community. So, nearly 20% are African American, either uninsured and penny eligible, but only 7% of our broker community is African American. That number even jumps, that disparity jumps even higher when we're talking about Hispanic Latino, Asian Pacific Islander, age, between 26 and 34, not necessarily represented in the broker community and speaking a language other than English. So we really see this as an opportunity for brokers to take advantage, either to learn another language or to bring brokers into your agency that are able to serve these populations. And also, we did one small step in from the marketing side of Penny. We were doing some market research of the uninsured, and this is really just kind of two highlights out of it that, we really found that uninsured African Americans in Pennsylvania they value the importance of health coverage almost way more than other survey demographics. And the other survey demographics were young folks in between 19 and 34, Hispanic Latinos, gig workers. So folks really kind of fell into a bunch of different pockets, and African Americans, above all, really valued and understood the importance of having health coverage. And they were also would be more motivated to shop for health coverage if they had that personal help that you brokers would be able to provide, because they felt overwhelmed with the application process and overwhelmed with the amount of plans and making sure that they were choosing the right plan. And then also we found that Hispanic audiences are more likely to schedule an in-person meeting compared to other demographics. So really, this is creating a lot of opportunity for brokers, and so much so that we combined a bunch of different data sources to develop what we call opportunity zones in Pennsylvania. So what are those data sources that informed an opportunity zone in PA? It is taking a couple different subsets of data and understanding where the high number of uninsured are, where the high rate of uninsured are amongst underserved communities, and then also a large population of those in the ALICE population. This is work done by the United Way, and ALICE stands for Asset Limited, Income Constrained, Employed, basically the working poor. And those are that population is most likely to receive a lot of APTC and cost sharing reductions, so that their health coverage fits within that constrained budget. So, and they're more likely to stay enrolled if it does stay within their budget. Want to make a note that our broker training and certification is available now, and it's linked here also at agency.penny.com/brokers. You can start that training to be certified to sell in plan year 2025. So who's available to use this data to find an opportunity zone in your area? Obviously, brokers, independent brokers, brokerages, new Penny certified brokers, insurers, anybody that can find this data useful, please grab it. And then we also pulled from our own internal health equity report, which has a ton of information that you could definitely use to find these types of pockets within Pennsylvania. So we grabbed SHADAC data to find where the most uninsured live in Pennsylvania. So you can see that by the map, the darker being Philadelphia County, the lighter being, a smaller number of uninsured living in those counties. And then we focused in again with the broker recruitment and diversification project in Philadelphia. These are ranked in order here by where the highest rate of uninsured are in Philadelphia County. And then again, looking at the ALICE data of where the higher number of ALICE population lives within Philadelphia County. And then we're also taking language into account for, again, this is just looking at Philadelphia County, that the population that speaks Spanish is over 155,000. There's over 10% of the county population speaks Spanish. And then it kind of goes down the line. So again, folks are looking for help from people that maybe look like them, that speaks their language. And this is really kind of where we've landed in the Penny life cycle, is that we feel that we've kind of reached, low-hanging medium fruit. For us to be able to reach further into the uninsured, it's going to take some extra work. So for you to be able to find your opportunity zone in your little pocket of Pennsylvania, we linked all of these data sources here so that you can kind of play around and find what works for you and your work. There's also a wealth of resources available for you to work with Penny. We have a ton of resources at agency.penny.com/brokers. It's really your kind of one-stop shop to get Penny certified, to claim an agency manager or a broker account. You can find updated helpful aids and resources, and we just recently updated a lot of those. We have a dedicated line for brokers so that you can get right to a customer service representative to be able to get you over whatever road bump or pothole. We definitely have plenty of those in PA to get you over those smoothly. So that number's right there, listed there, but also a dedicated email address to email your questions over, and we'll respond to that promptly. We also have language and translation support, and we're able to help over 240 languages. We have customer service reps that are bilingual, but we also have a translation line that acts as a mediator between you and the customer service rep. And then we also have free Penny educational materials. You're able to request those. We print them and mail them at no cost to you. And then we also supply you with our Penny certified broker logo, to which you can slap on any of your marketing materials. So you can put that at a lot of brokers will put that on a brochure, on a business card, or even in their email signature. Like I said, the broker training is live now at agency.penny.com/brokers. And the deck that we just went through is available now also at agency.penny.com/brokers. And the recording of this presentation will also be available there. But that concludes our presentation. Again, didn't want to take up too much of your time, but wanted to show you some of these great opportunities that we have identified so that you can use those to inform your work in bringing more uninsured Pennsylvanians over to Penny and get them covered with high quality, affordable coverage. So if there's no questions in the chat, we'll round everything out and thank everybody for your participation today, and make sure that you get over and get certified to sell on Penny. It is a very quick process, and it's been revamped this year to really help you navigate through that certification process. And then for a plug to our broker recruitment and diversification team, please fill out that demographic survey, because the broader pool that fills out that survey at the end of certification is only going to help us better inform for more market opportunities as we go through. So thank you again for participating today, for joining us on this webinar, and happy selling out there. Thank you again.